Understanding common pediatric illnesses and conditions. Introduction. Welcome to Common Pediatric Illnesses and Conditions. Why children are more susceptible. They have immature immune systems. They're exposed to infections in school and daycare settings. They often have poor hand hygiene. They have close contact with other children. The importance of early recognition. Early identification of symptoms leads to effective treatment. It prevents complications. It reduces the spread of contagious diseases. It provides peace of mind for families. Common respiratory conditions. Respiratory infections are among the most common in children. Upper respiratory infections include the common cold and sinusitis, usually viral and self-limiting. Lower respiratory infections include bronchiolitis and pneumonia, more serious and may require hospitalization. Croup, laryngotracheobronchitis. Signs include barking cough, inspiratory stridor, and hoarseness. Treatment involves humidified air, corticosteroids, and nebulized epinephrine. Asthma. Triggers include allergens, exercise, and cold air. Treatment uses bronchodilators, corticosteroids, and avoiding triggers. Requires long-term management and education. Bronchiolitis and RSV. Bronchiolitis is a common and potentially serious condition. Key facts. Most common in infants under 2 years. Often caused by respiratory syncytial virus or RSV. Symptoms include wheezing, retractions, nasal congestion, fever. Nursing care focuses on providing oxygen therapy if needed, suctioning secretions to maintain airway, ensuring adequate hydration, monitoring respiratory status closely. Prevention. High-risk infants can receive palivizumab or Synagis. This medication helps prevent severe RSV infection. Gastrointestinal conditions. GI conditions are common causes of pediatric illness. Gastroenteritis, stomach flu, caused by viral or bacterial infection. Symptoms include vomiting, diarrhea, and dehydration. Treatment focuses on oral rehydration therapy or for fluids if severe. Pyloric stenosis. Symptoms include projectile vomiting and an olive-shaped mass in the right upper quadrant. Treatment requires surgical correction called pyloromyotomy. Intussusception. Symptoms include severe colicky pain, current jelly stools, and sausage-shaped abdominal mass. Treatment involves air or contrast enema. Surgery is needed if the enema is unsuccessful. Neurological conditions. Neurological conditions can be frightening for families. Seizures. Febrile seizures are associated with fever and typically benign. Epilepsy involves recurrent unprovoked seizures. Treatment includes anti-epileptic drugs and safety precautions. Meningitis. Signs include fever, stiff neck, nuchal rigidity, photophobia, and irritability. Diagnosis requires lumbar puncture and CSF analysis. Treatment involves 4 antibiotics. Droplet precautions are needed for bacterial meningitis. Key nursing actions. Maintain seizure precautions. Protect the airway. Document seizure activity. Provide family education and support. Cardiovascular conditions. Heart conditions may be present from birth or develop later. Congenital heart defects. Cyanotic defects include tetralogy of Fallot and transposition of great arteries. Acyanotic defects include atrial septal defect and ventricular septal defect. Signs include cyanosis, failure to thrive, poor feeding, and heart murmur. Kawasaki disease. Symptoms include fever lasting more than 5 days. Characteristic findings, strawberry tongue, rash, swollen hands and feet. Complications can include coronary artery aneurysms. Treatment involves 4-immunoglobulin, IVIG, and aspirin. Nursing focus. Monitor cardiovascular status. Support nutrition and growth. Educate families about medications. Watch for complications. Infectious diseases. Many childhood infections are preventable through vaccination. Hand, foot, and mouth disease, caused by Coxsackie virus. Signs include fever, painful mouth sores, and rash on hands and feet. Care is supportive with focus on hydration and pain management. Scarlet fever. Signs include sore throat, sandpaper-like rash, and strawberry tongue. Treatment requires antibiotics, specifically penicillin. Chickenpox, varicella. Signs include itchy vesicular rash and fever. Complications can include pneumonia and encephalitis. Prevention through varicella vaccine is highly effective. Skin conditions. Skin conditions are common and often distressing. Eczema, atopic dermatitis. Symptoms include dry, itchy, and inflamed skin. Triggers include allergens, irritants, and dry air. Treatment involves moisturizers and topical steroids. Impetigo. Highly contagious bacterial skin infection. Signs include honey-colored crusted lesions. Treatment requires antibiotics, either topical or oral. Nursing care. Teach proper skin care. Prevent scratching to avoid secondary infection. Educate about trigger avoidance. Endocrine conditions. Endocrine disorders affect metabolism and growth. Type 1 diabetes mellitus. Results from autoimmune destruction of pancreatic beta cells. Symptoms include polyuria, polydipsia, weight loss, and fatigue. Management requires insulin therapy and glucose monitoring. Family education is essential. Hypothyroidism. Can be congenital or acquired. Symptoms include poor growth, lethargy, constipation, and dry skin. Treatment involves levothyroxine replacement. Key nursing roles. Monitor growth and development. Teach medication administration. Support families with lifestyle adjustments. Hematologic conditions. Blood disorders affect oxygen delivery and overall health. Iron deficiency anemia. Symptoms include pallor, fatigue, and tachycardia. Treatment involves iron supplementation and dietary changes. Prevention through iron-rich diet is important. Sickle cell disease. Symptoms include pain crises, anemia, and swelling in hands and feet. Complications include stroke and frequent infections. Treatment focuses on hydration, pain management, and hydroxyurea. Nursing priorities. Monitor for signs of complications. Provide pain management. Educate families about disease management. Musculoskeletal conditions. Bone and joint conditions affect mobility and development. Developmental dysplasia of the hip. Signs include asymmetrical gluteal folds and positive Barlow or Ortolani tests. Treatment involves Pavlik harness for infants. Early detection improves outcomes. Scoliosis. Signs include uneven shoulders and abnormal spinal curvature. Treatment involves bracing for moderate curves. Surgery may be needed if the curve is severe. Screening. Routine screening during well-child visits. Early intervention prevents progression. Mental health conditions. Mental health is as important as physical health. Autism spectrum disorder. Signs include impaired social interactions, repetitive behaviors, and speech delays. Interventions include early intervention programs, speech therapy, and structured routines. Attention deficit/hyperactivity disorder. Signs include inattention, hyperactivity, and impulsivity. Treatment combines behavioral therapy and medications like methylphenidate. Nursing support. Provide resources for families. Support developmental therapies. Reduce stigma through education. Poisoning and ingestions. Accidental poisoning is a common pediatric emergency. Common toxins. Medications left within reach. Household cleaners. Lead from paint or pipes. Emergency actions. Call poison control at 1-800-222-1222. Activated charcoal may be used for some ingestions. Lead poisoning may require chelation therapy if severe. Prevention. Keep all medications and chemicals locked away. Use child-resistant containers. Educate parents about poison prevention. Pediatric emergencies. Some conditions require immediate intervention. Anaphylaxis. Symptoms include swelling, difficulty breathing, and hypotension. Treatment requires immediate epinephrine IM using an EpiPen. Follow with antihistamines and observation. Drowning. Prevention includes constant supervision, pool fencing, and CPR training. Immediate CPR can save lives. Foreign body aspiration. Signs include coughing, stridor, and cyanosis. Intervention includes back blows and chest thrusts for infants. Use Heimlich maneuver for older children. Nursing interventions. Comprehensive nursing care improves outcomes. Key nursing actions. Monitor vital signs and hydration status regularly. Administer medications as prescribed. Assess response to treatments. Provide age-appropriate education for parents and caregivers. Encourage vaccinations for preventable diseases. Offer emotional support to families. Document all findings and interventions. Family-centered care. Include families in care planning. Provide clear discharge instructions. Arrange follow-up care. Let's summarize what we've learned about pediatric illnesses. Key takeaways. Recognizing early signs of illness prevents complications. Vaccination is key in preventing infectious diseases. Proper nursing interventions significantly improve outcomes. Family education empowers caregivers. Each condition requires specific assessment and management. Collaboration with interdisciplinary teams enhances care. Thank you for watching. Understanding these common conditions will help you provide comprehensive pediatric nursing care.